Hi, I'm Chad Martin with North Mississippi Business Community, and we're here today at Main Street Clinical Laboratory with Jeff King and Mark Vines. Tell me how your business got started.
I grew up with a dad who had his own business in Senatobia and always wanted my own as well. I was working with a multinational lab company in Memphis, and I was a CPA, so I was doing the CFO duties. We met many times, and they mentioned that the nursing home market wasn't covered by the large lab companies. And so that seemed on the surface like a good opportunity to get into. And when we looked at the market, there was only one player in the market of nursing homes, and they were sending their lab work 2 hours away. Being a CPA, we always focused on delivering timely, relevant, and accurate information. And if your turnaround time on your lab results was not as fast as it could possibly be after your draw time, then you were not releasing relevant and timely information, even if it was accurate. And so that's kind of how this was born, especially in the nursing home market, because they're chronically ill patients and they needed their results faster in order to be treated. And I've worked with Jeff many times in the past and knew that he had a skill set that was different than mine, but was very good at what he did. And it's kind of my Dr. Jekyll to Mr. Hyde, I guess.
I'm not sure which one I am.
Yeah, me neither.
But no, we saw a void in the market, taking care of those elderly patients in the long-term care setting. And we felt like we could really improve the health care that those patients were getting by coming into this market and doing that. And we've been very successful over the past 4 years serving that market.
What services do you guys offer that set you apart from your competition?
Well, I think as we entered this market in long-term care facilities, we saw a need there, something that we could do different. We accomplished that from a standpoint of quicker turnaround times on the lab results that the facilities were getting. What that did is it allowed them to keep more patients in-house, not having to send them out to the hospital to be treated. If they've got the results faster, they can make the medical decisions there in the facility and then treat them there if they could, or have to send them out anyway. But it gave them that option.
If anybody's gotten a lab bill, they know how much it can be, $400 or $500 a pop. We knew that was ridiculous. Even though you have a high deductible plan, that doesn't mean that you need to be spending your deductible each and every year. You would be thrilled if you didn't have to spend your deductible on health costs. And with lab work, you shouldn't have to. Lab work is fairly cheaply produced. There's no reason to get $400 or $500 or $1,000 lab bills. And that's the stance that we're taking in this environment.
Okay, what would you say, now we've talked about the doctor's offices, nursing homes, things like that, but the most important factor in the equation seems to be the patients. What is your advice to those people?
The patient is really a captive audience, or so they feel when they go to a doctor's office. They have the blood work done, and then they get a bill that is just astronomical, and they have to come 100% out of pocket for that bill because they have a high deductible or they're uninsured or whatever the case may be. We had a patient about a month ago, and I kid you not, the bill was $2,400 for lab tests that we only charge $70 for. If I'm a patient and I realize that there's a choice for the doctor to use a different lab to save me money, I want the doctor to use that lab. And I guess what I'm saying to the patient is that choice exists, and we'd be glad to have you.
Now, one of the most important things is, now how do our viewers get in touch with you guys?
Our phone number is 662-510-5432. Office hours are Monday through Friday, 8 a.m. to 5 p.m.
If you'd like to contact us via email, please send me an email at jking, JKING, at mainstreetlab, everything spelled out, .com.
Guys, thank you so much, first of all, for meeting with us today. Jeff.
Thank you.
Mark, thank you so much. It's been very informative. Guys, get involved in your health care and find out what's going on. It can only be more beneficial to you. And trust me, come see these guys. They know what they're talking about. Take care.